Have you ever wondered if the pill you take to protect your heart might also be quietly harming other parts of your body? Every day, more than 40 million Americans swallow a statin, believing it's their shield against heart attacks and strokes. These drugs are prescribed as if they're miracle pills. But what if the truth is more complicated? Statins are powerful, no one denies that. They've saved lives and earned their place as a cornerstone of modern medicine. But when a drug is strong enough to alter how your body works at a fundamental level, the story doesn't end with one benefit. It also brings hidden risks, some small, some serious, and some that could change your life forever. Today, we're uncovering the 10 statin side effects your doctor is praying you don't discover. By the end, you'll see the full picture. The benefits, the dangers, and the trade-offs you deserve to know before you ever put one of these pills in your mouth. And just a reminder, this video is for educational purposes only and is not medical advice. Always consult your doctor before making any changes to your medication. Now, let's dive in. Side effect number 1. Muscle pain and weakness. If you've ever felt sore after a workout, you know what muscle pain feels like. But imagine that ache lasting not just for a day, but for weeks, or even months. That's what many statin users report. Studies suggest that up to 29% of patients experience some form of muscle pain, weakness, or cramps while taking statins. Why does this happen? Statins work by blocking an enzyme in your liver that produces cholesterol. But this enzyme also plays a role in creating coenzyme Q10, a nutrient your muscles use for energy. Without enough CoQ10, your muscles can literally run out of fuel. The result? You feel tired climbing stairs, your arms ache when carrying groceries, or you might even struggle to get out of bed some mornings. In rare but serious cases, statins can trigger rhabdomyolysis, a dangerous condition where muscle fibers break down and flood your bloodstream, potentially damaging your kidneys. Now, let's be clear, rhabdomyolysis is rare. But muscle discomfort? That's far more common, and many patients never connect the dots back to their cholesterol pills. Some studies estimate that 1 in 5 people who stop taking statins do so because the muscle pain becomes unbearable. Side effect number 2. Cognitive effects. While statins are praised for protecting the heart, growing research has raised concerns about their potential impact on the brain. Some patients on long-term statin therapy have reported memory lapses, confusion, and difficulty concentrating, effects that can be deeply unsettling. Imagine forgetting why you entered a room or struggling to recall important details at work. These aren't just small inconveniences, but signs of how statins may interfere with normal cognitive function. In 2012, the U.S. Food and Drug Administration, FDA, even issued a warning about possible reversible cognitive side effects linked to statins. Though these symptoms usually improve once the drug is stopped, they can still take a toll on everyday life, affecting job performance, relationships, and independence. For someone already managing the stress of high cholesterol, this additional burden can feel overwhelming. Side effect number 3. Liver damage. Statins target the liver to lower cholesterol, but ironically, this can sometimes damage the very organ that processes them. Doctors typically monitor liver enzymes with blood tests when you start a statin. Elevated enzymes can signal liver inflammation, a warning sign your liver is under stress. Most patients won't develop severe liver disease, but the concern is real. In rare cases, statins can trigger hepatitis-like symptoms, such as fatigue, abdominal pain, or yellowing of the skin, jaundice. Think about it. The liver is your body's chemical factory, filtering toxins and processing nutrients. When that factory is compromised, every system in your body suffers. A 2017 study in The Lancet noted that while severe liver injury from statins is rare, mild liver enzyme elevations occur in up to 3% of patients. Numbers small enough that they don't make headlines, but significant when millions are on these drugs. And here's the kicker. Many people dismiss early symptoms like tiredness or nausea as just stress or aging, when in reality, their liver may be waving a red flag. Side effect number 4. Increased risk of diabetes. Yes, you heard that right. Statins, the drugs prescribed to protect your heart, may actually raise your risk of developing type 2 diabetes. A large meta-analysis published in The Lancet Diabetes and Endocrinology in 2014 found that statins increased the risk of new-onset diabetes by 9 to 12%. Why? Researchers believe statins may impair insulin sensitivity and reduce insulin secretion from the pancreas, both of which can push blood sugar higher. For someone already at risk, say, you're overweight, have high blood pressure, or a family history of diabetes, this side effect can be the tipping point. Let's put it in perspective. If 1,000 people take statins for 4 years, around 10 to 12 of them may develop diabetes who otherwise wouldn't have. That may sound small, but remember, over 200 million people worldwide are on statins. That's potentially millions of new diabetes cases tied to these drugs. It's a bitter irony. You take a statin to avoid heart disease, only to be handed a lifelong struggle with blood sugar. Side effect number 5. Memory loss and cognitive issues. Have you ever walked into a room and forgotten why? We all experience brain fog now and then, but for some statin users, it becomes a daily struggle. There have been countless reports of short-term memory loss, confusion, and difficulty concentrating linked to statins. Some patients say they feel like they're living in a haze. The FDA even issued a warning in 2012 about potential cognitive side effects of statins, acknowledging patient complaints of memory lapses and confusion. The theory: cholesterol isn't just bad fat. Your brain is actually about 60% fat, and cholesterol is crucial for forming cell membranes and neurotransmitters. When statins aggressively lower cholesterol, they may disrupt the brain's normal function. A study in JAMA Internal Medicine suggested that older adults on statins had a higher risk of cognitive impairment compared to non-users. Although some experts debate this link, the personal stories are hard to ignore. Imagine forgetting your child's birthday, misplacing words mid-sentence, or struggling to focus on a simple task. For many, that's not just getting older. It started when they began using statins. Side effect number 6. Sleep disturbances. Another overlooked side effect of statins is their ability to interfere with healthy sleep patterns. Some patients report insomnia, frequent nighttime waking, or even vivid nightmares, all of which can erode quality of life. Sleep is essential for both physical and mental health. Without it, you may notice higher stress levels, poor focus, and even increased risk of chronic conditions like diabetes or depression. A 2015 review in Current Pharmaceutical Design suggested that statins, especially lipophilic ones like simvastatin, may cross the blood-brain barrier and disrupt natural melatonin production, the hormone responsible for regulating sleep. So if you've been tossing and turning ever since starting your cholesterol medication, it may not be your imagination. It could be your statins quietly working against your rest. Side effect number 7. Digestive problems. Statins can be tough on the digestive system. Common complaints include constipation, diarrhea, nausea, indigestion, and bloating. Since statins are processed in the liver and gut, they can irritate the digestive tract. Some people describe feeling like they swallowed a brick after taking their pill. A survey published in BMJ Open found that up to 20% of statin users reported gastrointestinal side effects. And here's the problem. Digestive discomfort can lead to poor nutrient absorption, meaning your body doesn't get what it needs from food. Even worse, statins may alter the gut microbiome, the delicate ecosystem of bacteria in your intestines. Emerging research suggests this disruption could contribute not only to gut discomfort, but also to broader issues like weakened immunity and inflammation. If you've been blaming your diet for sudden stomach issues, your statin may be the real culprit. Side effect number 8. Rhabdomyolysis. One of the most frightening and rare complications of statin use is rhabdomyolysis, a condition where muscle fibers break down so severely that they release a protein called myoglobin into the bloodstream. This can overwhelm the kidneys, sometimes leading to acute kidney failure. The symptoms are unmistakable: severe muscle pain, weakness, and dark, cola-colored urine. Although rhabdomyolysis occurs in fewer than 1 in 10,000 statin users, it is considered a medical emergency because untreated cases can be life-threatening. A 2014 study in the American Journal of Medicine highlighted that while rare, statin-associated rhabdomyolysis remains a serious risk, particularly when combined with other medications that interact poorly with statins. This is why doctors emphasize immediate medical care if unusual or extreme muscle symptoms appear. Side effect number 9. Pancreatitis. While most people think of statins as affecting the heart, liver, or muscles, they can sometimes impact the pancreas, a vital organ that helps digest food and regulate blood sugar. Pancreatitis, or inflammation of the pancreas, is a rare but potentially severe side effect linked to statin therapy. The condition often begins with sudden and intense abdominal pain, usually in the upper belly, radiating to the back. This pain may be accompanied by nausea, vomiting, bloating, and even fever. What makes pancreatitis so dangerous is that it can escalate quickly. The pancreas can begin to digest itself, leading to tissue damage, infection, or organ failure in extreme cases. Although drug-induced pancreatitis only makes up about 2% of all pancreatitis cases, statins have appeared in multiple case reports as possible triggers. For example, a review in the World Journal of Gastroenterology highlighted instances where patients developed acute pancreatitis shortly after beginning statin treatment, which improved once the medication was discontinued. Researchers believe this may be due to toxic metabolites produced during statin breakdown in the liver, which can irritate or inflame pancreatic tissue. While extremely rare, the consequences can be life-threatening if ignored, making it essential to take persistent abdominal pain seriously, especially if you're on long-term statin therapy. Side effect number 10. Tendon complications. Statins are widely known for causing muscle-related issues, but few people realize they may also increase the risk of tendon injuries. Tendons are the strong, fibrous tissues that connect muscle to bone, allowing us to move, lift, and perform daily activities. Research has shown that statins can sometimes weaken tendons or slow down their ability to repair themselves, leading to problems like tendinitis, painful tendon inflammation, or, in severe cases, tendon rupture. A study published in Arthritis Care and Research found that people taking statins were more likely to develop tendon problems, particularly in the Achilles tendon, one of the most commonly injured tendons in the body. Symptoms can include persistent pain, stiffness, or swelling in the tendon area, especially after physical activity. What makes this particularly concerning is that tendon ruptures can be debilitating and require surgery to fix, leaving long recovery periods and potential loss of mobility. Scientists suspect that statins may interfere with collagen production, a protein crucial for keeping tendons strong and flexible. Even though tendon issues are not as frequently discussed as muscle pain or liver problems, they can be equally disruptive, especially for people who are physically active or rely on mobility for their work. For patients on statins, paying attention to new or worsening joint or tendon pain is vital, because catching the warning signs early can prevent a minor issue from becoming a major, life-altering injury. Statins are powerful drugs, and for many, they're life-saving. But powerful drugs rarely come without trade-offs. From muscle aches to memory lapses, from liver stress to rare kidney failure, the risks are real, even if they're not often discussed in the exam room. Being informed doesn't mean rejecting treatment. It means making decisions with your eyes open, balancing benefits against risks, and working with your doctor to find the safest path forward. Thank you for watching. If you found this video eye-opening, hit the like button and share it with someone who should know this information. Don't forget to subscribe for more science-backed health content designed to empower you with knowledge. Because when it comes to your health, the best medicine is awareness.